Hello. Hi, everyone. Today is November, Friday the 13th. This is a noteworthy day because today marks exactly 8 months since the first announcement of COVID-19 in Alabama. The first case in Alabama was reported on Friday the 13th in March, and here we are again 8 months later on Friday, November the 13th. So, hi, I'm Rundy Murphy. I'm an epidemiologist and the Director of Disease Surveillance at the Mobile County Health Department. I'm giving you our update, our Friday 2:30 update on COVID-19 and the effect on Mobile County. Globally, nearly 53 million cases with 1.3 million deaths. In the U.S., 10.5 million cases with over 240,000 deaths. And in Alabama today, 213,617 cases with 3,231 deaths. You know, you've seen in the news that the United States has reported record high numbers of COVID-19 cases every day now for, I think, 3-4 days in a row. Everything is trending upward. Cases are going up. Hospitalizations are going up. We have more outbreaks going on around the county. It's just really a critical time right now, and I think largely projected that we would see a fall surge, and here it is. And so we have to continue to be diligent to try to slow the spread as to not to overwhelm our healthcare system. So about Mobile County today, we're reporting on 18,428 cases of COVID-19. 109 cases were reported yesterday, Thursday. On Wednesday, 132. On Tuesday, 113. And on Monday, 183 cases were reported. So if we look at the past 7 days, number of cases compared with the 7 days prior to that, our number of cases has increased by more than a third. So around a 36% increase in the number of cases reported in the week prior to the last 7 days. 339 people have reportedly died with COVID-19. That's an increase of 2 from yesterday. This death number is likely to go up as we receive delayed death certificates where COVID was not listed as the primary cause of death, but a contributing factor. And because of that, the state is working through around 4,000 death certificates, trying to determine if these death certificates need to be reported as probable COVID deaths because they perhaps did not have COVID listed as the cause of death, but as a contributing factor. So stay tuned on that as the state works through those death certificates. As you know, death certificates there's quite a lag in certifying and receiving finalized death certificates. For hospitalizations, the cumulative number of people hospitalized with COVID-19 is at 2,423. That's an increase of 27 since yesterday. And if you look at the number of people hospitalized on any given day, and we track this as one of our indicators, yesterday there were 94 people in the hospital with COVID-19. That was an increase of 8 just from the day before. So, in the past few weeks, I've been talking about how the hospitalizations have been creeping up, sort of following a couple of weeks behind our increase in the number of cases. But we've seen, again, the last 7 days compared to the week before that, about a 36 increase in the number of COVID-19. And that is mirrored in our hospitalizations, where we are now seeing in the, yesterday, mid-90s, 94 people hospitalized with COVID. So I have gotten a lot of questions about the hospitals and the shape that the hospitals are in, questions from the media, hearing things in the community that the hospitals are full or at full capacity. Is that something that we worry about? And yes, it is something that we worry about. I took a peek at the capacity numbers just before coming into this broadcast. And if I look sort of at all the hospitals combined, at least the data reported yesterday by the hospitals, there were just a handful of intensive care unit beds that were not filled. So most of our ICU beds are filled. Now, that does not mean that our hospitals are in dire straits, because we have seen before that they can adapt to surges and needs for ICU beds and just normal beds and COVID beds as they need to. So I don't want you to think that just because we have a handful of empty ICU beds that things are terrible, because our hospitals, again, have shown that they can adapt and adjust to the need. In the summer, in late July, when we were experiencing our highest number of cases reported, our most high widespread transmission, there were a few days there where we had over 200 people in the hospital with COVID each day. So we're still less than half that. So we are keeping a close eye on it. We want to make sure everyone is doing what they can do to try to reduce exposure to people who are going to get sick and may get sick enough to require hospitalization. Let's see, somebody asking about the running tally on the number of complaints. I did not get that report just before coming in, but Jean's working on that for us, and we will have that to you next time, or maybe over email. Also, some media questions about a New York Times article saying that restaurants are by far the riskiest places, about 4 times riskier than gyms and coffee shops, followed by hotels. Do I think that indoor dining in Mobile County has contributed to case numbers? Yes, I do think that indoor dining has contributed to case numbers. As studies have shown time and again that people who dine out are at greater risk of COVID infection than those who do not dine out. And this is really multifactorial. I think when you're in a restaurant, you're around, gatherings of people that you can't always maintain a 6-foot distance, though many restaurants are doing a great job at this. It's also a situation where you have your mask off for long periods of time because you're eating or drinking, and these behaviors, you can't wear a mask when you're doing that. So you're in a space where there are more aerosols being, in the air, and you could potentially come in contact with those as they drop on surfaces, or if they drop on doorknobs, or if they drop on bathroom sinks. So again, it's somewhat related to being indoors, being at a higher density of people, not wearing a mask for a large part of the time. These are the types of things that make indoor dining a riskier endeavor than being in settings like a coffee shop where there are fewer people, or like a gym where you can wear your mask while you're there. In a restaurant or a bar, are not able to do that. So also some questions wondering if our case investigators and contact tracers have identified any surges based specifically on dining, indoor or outdoor dining. And not specifically, we have not, but we do have clusters of COVID in lots of settings around town that we have not detected through our normal investigation and contact tracing. So certainly we do not know about all of the indoor and outdoor dining areas that might have contributed to spread. What makes indoor dining higher risk? Again, when you're indoor in a confined space, there's less air circulation and you're closer together, and that's what puts you at greater risk. When you're outdoors and you have more open air, there's more air circulation, you're able to sort of, you have no wall barriers, right? You can spread out more. And these are the things that make outdoor dining less risky than indoor. Remember, we've been saying that outdoors is better, shorter is better, sort of shorter length of time. So, your time in a coffee shop might be much shorter than the time that you spend in a restaurant. And then fewer is better. So the fewer people that you are around, or the fewer people in a closed space, the fewer people in an indoor space, the lower the risk. Someone asking again from the media, could we see another shutdown if the numbers go up? How do we balance safety while still keeping restaurant and businesses open? So it is doubtful that we will go back to a forced stay-at-home order for 6 or 8 or 10 weeks at a time, like we did in the spring. I think what everyone recognizes is that as a society, we have to learn how to be safer as we go about our lives. And if we are at high risk of severe complications, then those folks are the ones that should really think about staying home to the greatest extent possible. But largely, younger people, young adults, will have very few serious illnesses, very few complications, and we need to balance, economy and culture and the social creatures that we are with our need to stay safe. And the way you stay safe is by wearing your face covering, washing your hands, staying at home if you're sick. If you are sick with COVID, you have to stay home for 10 days. If you've been exposed to COVID, like someone in your household or someone at your job, you need to stay home for 14 days. This is the requirement, right? It's not suggestion. This is what's going to keep us from spreading COVID around our community. Wearing a face mask, washing hands, staying at home if you're ill, staying at home if you've been exposed, disinfecting surfaces, covering your cough, those sorts of things. That's the only way that we can slow the spread, can prevent things like shutdowns, can prevent things like cancellation of events, and try to balance, our economy and the social beings that we are with the risk to health and healthiness. Oh, wait, I think there's some more questions here. Let's see. Okay, these are one more question from the media. Let me take care of this one first. Someone asking from the media if treatments that have been developed, have they helped keep hospitalizations down in Mobile County? And while I don't have quantitative data to back this up, nationwide, there have been study to show that convalescent plasma, remdesivir, things of this nature have helped to reduce severe complications of COVID and have reduced mortality in people who become severely ill. There is a new treatment that just obtained FDA emergency use authorization this week, a monoclonal antibody that I have not learned how to pronounce yet, but also something that has come out for the treatment of less ill people. So this is great because this will be sort of the first treatment that has been authorized for emergency use that's for people who aren't severely ill necessarily, but maybe who are at risk of becoming severely ill and are early in their illness disease progression. So more to come on that later. All right, Facebook questions. Let's see. Asking about, these are vaccine questions. So someone asking if the vaccine, I'm assuming that we're talking about the one that was just announced, had 90% protection. Will it work on other strands? And so I think where this is going is that, influenza, there are a lot of different types of influenza based on their surface antigens and their genetic makeup and those sorts of things. So that's why the flu shot doesn't work great on all strains, right? We usually include 3 or 4 different strains in the flu shot, and we hope we get close to the one that is circulating in the flu season. But SARS-CoV-2 is not like influenza in that regard. Right now, there are some slight variances in SARS-CoV-2 that are isolated from different geographies. For example, subtle differences in the genetic makeup from SARS-CoV that's circulating in Europe, from SARS-CoV that's circulating in Asia, those sorts of things. But these are not significant enough to think that it will take more than one vaccine to protect against them. So, yes, there are different types of coronaviruses, but so far, SARS-CoV-2, that's the name for the virus that causes COVID-19, has not changed so dramatically that we expect to need different types of vaccine for different strands of virus. Let's see, would elders need a higher dose like the flu vaccine? I don't know yet. I don't think so. But it will be up to the Advisory Committee on Immunization Practices to look at the data being generated by these pharmaceutical companies who are producing the vaccine and they will make some decisions based on who is prioritized for receiving the vaccine, how many doses are needed, if elders or children, for example, would need some different dosing strategies. So more to come on that. Those are decisions made at the federal level, not here. And then just a comment from someone on Facebook that they hope FDA follows regular standard protocols. They are doing that. They are following all of the standard protocols. They're accelerated a little bit, but no step is being skipped. And part of the way, for example, that they're trying to accelerate delivery is that they're pre-positioning vaccine that has already been manufactured, pre-positioning it so that when FDA clears it for emergency use authorization, it will already be close in the hands of the people who need to give it out. So, like, for example, there will be vaccine in 5 or 6 locations in Alabama prior to the EUA being approved, and so that when it is approved, people can start getting vaccines as soon as possible. But please know that FDA is not skipping any steps in trying to get a COVID vaccine to the people who need it most. All right. Couple other things just to say before we sign off for this Friday. I want to make sure everyone remembers that if you have COVID, you isolate for 10 days, period. You go home for 10 days. If you are exposed to COVID, you go home for 14 days, period. 10 and 14, that's the rule. No testing out. No, but I've got to work. No, but my plane ticket is this week to Las Vegas. None of that, right? If you are exposed to COVID, you must stay home for 14 days. And if you have COVID, you have to stay home for 10 and 14. That's what you need to remember. If you have questions about that, send us an email to covid19@mchd.gov. Another thing is
.org.
Oh, sorry. Thank you, James. covid19@mchd.org. O-R-G, not gov. mchd.org. Thank you so much. Another thing I wanted to say is that I'm wearing my Get Tested for COVID t-shirt today at the health department every Friday. We try to continue getting the word out that anyone who wants a COVID test can get a COVID test. You can call our appointment line at 690-8889, and you can make an appointment to get tested at any of our locations around the county. I think we have 8 or 9 locations. 690-8889. Get tested. We need people to get tested. There's plenty of testing capacity. If you just feel like you don't feel well, go get tested. If you think you may, have been exposed to someone 4 or 5 days ago, that now they found out they had COVID, go get tested. Get tested next week again if you need to, but please, we need people to get tested. Testing and recognition of where the disease is another way that we can slow spread. So it's just all these layers that we can add to hopefully, have a better shield against COVID-19. And then next week, you'll hear an initiative that the Health Department and Family Health, our primary care division, are getting behind called Know Before You Go. A week from now, people will be ready to, potentially travel to be with their families for Thanksgiving. And in particular, college students, their semesters are going to be ending. They will be traveling back home. You may have relatives that are coming from other states to visit you in Mobile. And I just want to emphasize that one of the things that we'd like for you to consider, particularly if you are a young adult, before you travel home to return from your family, if you've been on campus, if you've been living in an apartment while going to school, please get tested a couple days before you go home. Know your COVID status before you go so that you don't inadvertently expose people back at your home, your parents, your cousins, your grandparents, your aunts and uncles, because we certainly don't want you unknowingly spreading COVID at your family gathering. And then, so again, get tested, know before you go. And then I wanted just to read through, CDC has issued or updated actually their guidance for holidays, celebrations, and small gatherings. We know people are going to do it, but there are some things that you can do to keep yourself safe. So check the the infection rates of where you're going. Know if you're going into a really hotbed for COVID. And this is really important that you understand sort of what the community level of transmission is where you're going. Always limit the number of attendees. Again, a shorter celebration, an outdoors celebration, and a celebration with fewer people is better. Those things will reduce the risk of COVID transmission at your dinner or out at your gathering. Increase the ventilation by maybe opening windows or doors if they have screens on them, running your fan on your heating and air conditioning unit nonstop. Consider outdoor seating and maybe a pop-up tent or umbrellas where you can sit members of different households, 6 feet apart, and let them have sort of their own sort of space. Require your guests to wear a mask. I think that would be sort of a given, but maybe not. Encourage, your whoever attends to wear a mask. Encourage guests to avoid singing or shouting. These are things that cause respiratory droplets that could carry COVID to go further than the normal sort of just couple of meters. So try to avoid shouting or singing. Make sure you're washing your hands. Ask your guests to bring some supplies, right? Bring your own hand sanitizer. Bring your own masks. Bring your own sanitized wipes. Limit contact with commonly touched surfaces, and this is just not doorknobs, right? In a dining situation, it's serving utensils, it's the tea pitcher, it's the salt and pepper shaker. So to the extent possible, try to have individual sizes of things like salad dressing or ketchup or salt and pepper, those sorts of things, so that you're not, you don't have a lot of people touching the same things. Use touchless garbage cans if you can. Ask your guests, your family, to try to make sure they're avoiding, community exposures in the week or 2 weeks prior to coming to your place. So plan ahead. And we'll talk more about some of these things next week, but I just wanted to put a few ideas in your brain so that as you're beginning to plan what you're going to eat, who you're going to invite, where you're going to how you're going to feed people, where they're going to sit, that you can think about some of these things. So remember, shorter is better, outdoors is better, fewer people is better, all those things to reduce risk. So I will end there, and thank you for your attention today. I hope you found some of this information helpful, and we will talk to you again on Monday.